When a migraine happens, it creates changes in the brain, which overall have an impact on a person's quality of life and their abilities and ability to develop brain diseases. The relationship shows that those with long-term risks may face a higher issue of damaging parts of the brain and further debilitating their issues with their lives. These issues are not solely linked to strokes, but they have also been found to be correlated with Alzheimer's. The article Association Between Migraines and Alzheimer's Disease gives statistics showing that the overall incidence of Alzheimer's in participants with no migraine history was low, was 3.7%, whereas that with migraine history was 7.1%. The presence of migraines in individuals has the potential to be a direct contributor to the increased risks of Alzheimer's disease. Many young individuals will be unaware of the risks and only come to learn about the long-term effects once they reach an older age, showing that migraines are more harmful to those who are 50 years of age. Not only is migraines related to Alzheimer's, but Alzheimer's in itself is an issue that affects the whole country. As the chart 2024 Alzheimer's disease facts and figures given by the College Board Stimulus shows the overall amount of people who suffer from Alzheimer's. And if we look here, the area in the blue shows that the majority of these people are 85 years and older. While many of these cases are not related to migraines, by minimizing the amount of migraines that then turn into Alzheimer's disease, the overall amount of Alzheimer's would also decrease. Third is the effect on social relationships. Not only can the cognitive decline be associated with societal relationships, but also the amount of migraines that a person gets hinders their everyday lives. And Walkos, author of the article Epidemiological Assessment of Migraine Frequency, wrote, as migraine frequency increased, close friends were more likely to view the migraine pain as fake. And both children and close friends were more likely to perceive the migraine pain as exaggerated as frequency increased. Once a person begins to have more migraines, it becomes difficult for them to interact with others in their everyday lives. This often causes them to feel shunned out of society and become less involved in their peers and their loved ones' lives. Memory loss affects time spent with others. As stated earlier, one of the many impacts of migraines is its effects on memory. Memory impairment causes issues in other aspects of life, particularly in the way a person interacts with others. Migraines, as they occur, often cause extreme pain to the individual and can become a hindrance in their everyday lives. It becomes hard for them to concentrate on activities occurring around them. And while this is an issue, the bigger problem comes from the long-term effects that migraines have on a person's societal relationship. The article, Subjective Decline in Patients with Migraine, best explains, in conclusion, SCD seems relatively common in adult migraineurs in both terms of gender and migraine subtype. Migraineurs with SCD reported severe pain and impact of headache, were more depressed, anxious, and had poorer sleep quality compared to those without migraines. As a person's cognitive ability continues to decline, it hinders them from being able to form true societal relationships with others. Many of these stem from not only the neurological aspect of migraines, but also the emotional and physical toll it takes on a person. These are some solutions. These include taking migraine medication, which can either be preventative or pain relieving. As Amal Sterling, a neurologist from Mayo Clinic, defines, works by taking drugs regularly, often daily, to reduce the severity of migraines. Additionally, as mentioned previously, migraines affect memories. To fix this issue, individuals can try relying on past experiences to feel better about themselves and regain their memories. As the article, False Nostalgia, as provided by the College Board Stimulus, says, people going through rough times can be helped by remembering better days in their past for dementia sufferers, nostalgia can help establish some sense of personal continuity. However, these are not perfect. Migraine medication is not completely effective and often has side effects. Some of these side effects might include nausea, vomiting, feeling tired, being sick, or even not feeling well overall. Thank you.
Okay, I do have two questions for you. First up, what evidence did you gather that you didn't use, and then why did you decide not to use it?
I gathered a lot of evidence about how migraine affects teenagers and children. However, I decided not to use this because I also gathered a lot of evidence about how migraines affect people who are 50 years of age, specifically with Alzheimer's and ischemic stroke. And I decided if I use both of these, then it would create a too broad of a research topic, and I wouldn't be able to fully cover the entire thing.
Okay, and I just looked too. What additional questions kind of popped up as you were working your way through everything?
While I was working my way, I was thinking about how migraines actually function. So I researched this a bit, and I found that the way that migraines form is very complex and can be different from each person to person. So someone can get migraines when they're like a child, or they can be getting migraines when they're an adult. So these questions popped up in my head. I was researching why migraines occur and how it affects people over 50 years of age specifically.